there's still so much work to do. First of all, I think as a professional like myself, I think to really maintain that cultural humility. So when stepping into a community, really recognizing my limitations, but also the ability for us to kind of help facilitate processes. So I use a lot of different activities to kind of flip the classroom, for example. Some things called liberating structures, where you facilitate groups of people because really the solution exists within each of these populations. They know their people, they know their concerns, they know how to mobilize their own resources. So, but to be able to introduce knowledge, clarify misperceptions, give them helpful strategies and a framework to move forward. And then sometimes funding. For example, in Africa, they're in desperate need of funding to fund some of these positions to move forward. For example, the salary of a navigator in Africa might just be $3,000 a year. So even to help them get started, to help with the organization and the infrastructure, I think has great possibilities. And so I think it's really hopeful to make that happen. Also looking toward the future, I think the nursing workforce, we know we've got nursing workforce shortages. And this is one of the things that it's been on my heart for many years, and I've tried to do is to try to find individuals from within the community to kind of mentor and grow. For example, rural people who want to go back to nursing school, American Indian. Right now I've got a American Indian nurse that I have known since before she got her bachelor's degree. So she was my mentee from a program where she was first in her family to go to college. She was from a tribe in North Dakota. Then she went on to get her master's degree. I helped her do a publication. We went and presented a poster, and now she just enrolled in a PhD program. So I'm just so excited for her and so proud of her. So I think really finding people from within to really go and inform their communities, grow their resources. I think that's where the future is, and that's where the bright future is too, of really giving them a hand to help them, progress in cancer care. And with navigation in particular, you can do navigation starting to be very mobile too. So people can be remote at a distance, have phone conversations with people, um, telehealth, all of these things. So I think it's going to really open the doors too, so that we can really use people from within the community to help navigate to some of these bigger cancer centers and these bigger cancer systems. Navigation continues to be a foundation, and even when it was first kind of conceived at the birth of navigation, it really was to reach out to some of the more marginalized communities. And I think what's happened is that it's expanded throughout cancer care in a lot of areas. But some of these pockets are still untouched. And so I think we just all need to be mindful of that. And I know at City of Hope, we're really trying to address some of this and even expand navigation in some of our own clinics. I mean, we're spread now across the US, in Atlanta, in Phoenix, in Illinois, and then throughout California. We touch a lot of rural patients. We touch a lot of people from different racial and ethnic backgrounds. And so those same principles exist for trying to really make sure we connect with our populations, the people that we are serving, to make sure that we're giving them exactly what they need and helping them to feel equipped, to go through this cancer journey. I think that's the most important thing.